medicine specialist and practicing since last 40 years and in the field of medicine. I've been working in the headquarters hospital and different hospitals of Odisha, and after I was promoted to additional director and retired. Okay. Now we'll progress. My topic is hypertension. In details, this year on May 17th, we celebrate the World Hypertension Day. A day decided to highlight the importance of the monitoring of the blood pressure and bringing global awareness of the 1 billion people living in the high blood pressure worldwide. The theme of this year, the World Hypertension Day, is measure your blood pressure and control, live long. So the main importance of this discussion is to create an awareness of the blood pressure among the general public. The blood pressure is a silent killer. Blood pressure is due to rise of the pressure in the blood vessels while the blood pumps the blood. The heart pumps the blood. So there is a resistance in the blood vessels and there is pressure exerted due to pumping of the blood. So usually this blood pressure is seen in many patients, and we see that it is due to the genetic causes, familial, and majorly it is due to the change in the lifestyle. In the lifestyle means they exercise, having no exercise or sedentary life, and diet is not proper. They are not taking good diet, and there is stressful life, and then not able to maintain their stress, control their stress, and there is other habits like smoking and drinking alcohol, and do not adhere to the medicine that is advised to them. So our principle is to control the BP so that one can live happily in a healthy life. So to control the BP, number one, regular monitoring of the BP is very important. That should be monitored regularly and repeatedly. And patient should consult the doctors regularly and take the advice. But BP, one cannot every time go to the doctor and check the BP. So we advise that you try to keep one blood pressure monitoring instrument so that at home you can monitor the BP. And in different times you record the BP so that their variability can be known and the treatment will be accordingly managed. Apart from that, the patients are advised to have good exercise, like walking minimum for 30 minutes per day or at least 5 days a week. 30 minutes per day, at least 5 days a week. And along with the exercise, diet should be proper and good, healthy diet. That means that the diet should contain these fruits, salads, and should avoid the fatty diets and fast foods. Next, we come to quitting of the smoking and alcohol. So that is a very main important thing nowadays. Smoking that affects the blood vessels and heart, that creates the stiffness of the vessels and rise of the blood vessel. Then alcohol, that also has a very hazardous effect on the heart and blood vessels. So one must quit smoking and avoid taking alcohol. Next, we go for regular blood pressure monitoring. And I told that blood pressure should be recorded every time, either going to the nearby doctor, or for better management, one can keep a blood pressure monitoring instrument in their house, and the persons they should learn how to measuring the BP, and that will give a better knowledge of the blood pressure. And blood pressure monitoring, the monitor should be regularly graduated or calibrated to a standard instrument in the hospital or some other doctor's clinic, so that the recordings are accurate. Then last thing is taking medicines regularly. One should consult the doctors and take the medicines regularly without avoiding or skipping the dose. So these are the three basic things one should maintain to keep the blood pressure in a standard level, so that there will be the person will have a very good life and live happily.